As you are all aware, we gave the county 21-day strike notice that we gave on 11th that was expiring today regarding the issues within the CBA. So we've been having a discussion over these matters. 70% of the demands that we wanted from the county have actually been achieved. And given the fact that we have the situation of pandemic, we have decided to agree and suspend the strike effective immediately as we are engaging in further discussions. And then we have had a memorandum of understanding in which the county has promoted about 104 doctors in job group P, Q, and R, which had not been done for the last 10 years. And then the issues of doctors who are lacking medical cover, we had an agreement on the timelines in which they will give these particular things. So far we've had a fruitful discussion for 3 days, and we've come up with a document that will follow up the streamline as people are working. So we are grateful for the county, but then we also say that the MOU that we've had that has been signed should guide us in having an harmony. Because without that, then we may proceed again to have industrial disharmony. So we believe that the county will commit to the agreements that we've had, and then we will keep part of our bargain to continue working so that as this expires, everything will be implemented.
We want to assure our health workforce that indeed we care for their welfare and that we listen to them. Indeed, even before the strike notice came, we had already started moving in terms of making sure that our doctors and other healthcare professionals have been promoted and given what they deserve. On the issue of training, this county actually, as we speak now, has almost 69 doctors. 69? Yeah, who are 79. 79 doctors who are on postgraduate studies. That is how we care for our health workforce, so that when they come back with more expertise, they can serve our people. We will deliver our part of the bargain. After all, the doctors deserve it. And as a responsible government, we will give it to them. And we shall ask of them that we continue with a good working relationship. We have had tremendous improvement in provision of healthcare in Nakuru, courtesy of our healthcare workers, and we wish to do the same. To our clients who are our patients or people who visit our facilities, we wish to let you know that no services have been stopped or stalled any time today, and we are